Thank you very much for inviting me in the final conference of C3-Cloud. I'm very happy that you reached this point in time and in such a good shape, and that you have invited me, you and your consortium. Also, many thanks to the participants who have joined this day. I invite them to stay until the end of the day because it's really an interesting program you have compiled there. Before I begin, I'd like to apologize sincerely for being over the phone. You don't see me or any slides. It's mostly for two reasons. First of all, the firewalls of the European Commission. I don't know if external hackers can intrude, but they're certainly very strict to Commission employees when using these apps, and we don't control the events. And secondly, as you might know, we are in the middle of very complex and long evaluations for our research programs. And as soon as I close the phone, I have to be in meetings. So that was the only way possible this morning. Sorry again. I am a policy and program officer for the European Commission, DG Connect. Connect stands for Communications, Networks, Content and Technology Directorate General. And in my unit, we tend to promote policies in the area of e-health, well-being and aging. Now, an important pillar of our work is our funding programs. And when it comes to research and innovation, for the past 7 years, the 7-year period is a period where the budget of the European Union is valid, and it ends this year. Horizon 2020 was the biggest program we funded, and that's the umbrella under which C3-Cloud is funded. Now, our calls usually promote and facilitate research, innovation, and deployment of digital solutions for health and care in the EU. This includes, for example, technologies like telemedicine, big data, artificial intelligence, and such stuff. Now, although I'm not a very good storyteller, I'll try to tell a story for the beginning of this conference, and maybe you will fill in the gaps by the end of it. Now, in 2015, we launched a call which was called Advanced ICT Systems and Services for Integrated Care at the time, and it was a research and innovation action. Now, this was under the personalized health and care umbrella of our calls at the time. And we aimed to address particular challenges that we are still trying to address today. And this had to do with chronic diseases and multimorbidity, and how advanced ICT systems and services could improve quality of care and quality of life for patients and alleviate the increasing burden that these diseases were posing on the sustainability of the healthcare systems in the EU. Now, there was and there always is a focus on the needs of patients and older persons, and we aimed for some quality proposals which would have multidisciplinarity, which would improve coordination of health and care, and which would be focused also on community and home care settings, not only on hospitals, and on proactive care. Now, the European Commission also has some other, let's say, horizontal requirements in its calls, and it is that digital solutions, in the case of DG Connect, are privacy compliant, that these healthcare solutions are accurate, of course, and that they contribute to cost effectiveness. So that we can show the benefits of ICT technologies compared to traditional methods of care. We wanted the facilitation of patient monitoring of their status, their activities, and the compliance with therapy through that call. And we also wanted the fusion and analysis and of course, intelligent interpretation of patient and care provider data to improve decision-making in the area of health and care. Now, what we hoped to achieve with that call was actually a number of elements, and you might see during the day, and it would be interesting if the participants could discuss how C3-Cloud fared in that regard. But our aims, they are always a bit ambitious. Reduced admissions to care institutions and days spent there, improvements in the daily activities and quality of life of older persons through the digitized processes of each project, and then the evidence of the ICT-related gains in that respect, improved cooperation among the actors involved in health, social, or informal care services, and also a secure information exchange. That's very important. And finally, but most importantly, improved interaction between the patients and their carers, and a more active participation of the patients themselves and their relatives in the care process. Now, as a result of that call, C3-Cloud was one of 6 projects funded. I would love to give statistics or an outcome of that call, but only a couple have already finished. We are waiting the remaining projects to finish this year and early next year. They were all focused though on chronic diseases, despite being particular in each one of them in their own nature and complementary, I would like to say. So that's a very interesting portfolio for us to draw conclusions, and I'm sure we will be in touch with C3-Cloud next year in the process of a broader exercise. So the question is, how has C3-Cloud fared so far in the aims we set, and what's going to happen in the future, and also how the European Commission can help, and would be very happy to receive feedback on that at the end of the day and later on in the process. What I would like to point out though is that during the past 2 years that I am actively following this project, I can surely say that indeed the C3-Cloud tried to do what it promised, which was to develop these new patient pathways and organization models to improve caring activities actually. And especially during these last couple of years, it made a significant progress in finalizing and delivering the solution and in running the pilots in the 3 sites, which is never easy, especially in the past few months due to the COVID situation, in reaching its conclusions, which I hope you will discuss extensively today, and we will discuss in our review meeting, and also in stepping up its dissemination, communication activities, and move on with its very interesting exploitation plan. On our side, I would like to say that we were happy to announce a couple of months ago that already 3 innovations of C3-Cloud were marked as key innovations in our framework of assessment, which is called the Innovation Radar. This is actually a commission platform which draws from the feedback of our experts, who, when reviewing the projects, they provide us with a view of their market potential. There is a publicly available methodology that we're following for that. And although I firmly believe that innovations are just in the market and on their various components and usefulness, price, and so on, so don't put much attention to a policymaker telling you if an innovation is good, go to the market for that. We do hope that this assessment proves the progress of C3-Cloud, and also it will facilitate the creation of new opportunities in research in the future or commercialization of its results, be it nationally at EU level or hopefully at a global level. Why not? Like I said before, today's agenda is really interesting. As a policymaker, I'm more interested in the final part, which is what's next. Well, you will certainly have an important conversation regarding further research on the market, and that's one possible pathway for C3-Cloud and the results already achieved. There's another one, which is maybe future research opportunities and funding from the European Commission. And there, in case anyone's interested, before I close my intervention, I can say that we are in a very interesting period, which happens only once every 7 years. We are negotiating the new budget for the next 7 years, and especially the priorities for the next couple of years, which include recovery. And there, although we cannot say much because still our MEPs and our national capitals are discussing and brushing out the details of the new programs, we are quite convinced that there will be a bundle of opportunities. There will be a successor to Horizon 2020, which will be Horizon Europe, and it will still focus on research and innovation as before, as you knew before. We will have CEF2, which will focus on connectivity. We will have the Digital Euro program, which is a new program, and it will focus more on deployment of technologies and infrastructures, digital infrastructures. And this is a focus of DG Connect, actually. We will have the new EU for Health program, which will contribute to the deployment of more mature infrastructures and capacity building in member states. We will have the new recovery facility, which will be more focused on how we bounce back from the pandemic and how we help the recovery, among others, in the area of health. And finally, the cohesion funds, who are overlooked sometimes, but they focus on regional development and investments in the area of health and digital as well. I think I can close with that. I let you in very good hands. We are very interested to know more about the outcome of this day. And I'm sure that Theo and his colleagues will inform us and share the material with us, as we will be meeting very soon for the final review of the project, which doesn't mean the end of our relationship necessarily, but is also a necessary step to bring closure to something you should be proud of. But thank you very much.
Thank you, Orestis, for your introduction to this conference and for all the useful comments, starting from what happened on the call we are part of and for the future. Of course, as promised, all the information from the proceedings of this conference will be in our dissemination deliverable, and we look forward to our final review as well.
Yes, me too. Believe me, I'd love to be there for the entire day. Actually, evaluations are very interesting because you are looking at the prospects of future projects, and it's very exciting. But in my view, a final conference like this is about what has been achieved and the progress really made, and it's the most interesting part. Unfortunately, the timing is not the best at the moment, and the IT in my disposal. Sorry.
Fully understand. Thank you for being with us this morning.
Have a great day.
Thank you.